Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. These were probably the most awkward 20 seconds of our lives, but also the amount of time that the Center of Disease Control, CDC for short, recommends us to wash our hands. Hand washing. Why possibly would someone talk about something as mundane as hand washing at a TED Talk? Although hand washing has always been an important topic which has been overlooked, it's now more important than ever because of the pandemic. The vast majority of infectious diseases are transferred by touch. And here by touch, I don't mean just shaking hands. Say, opening the door or pressing a lift button which was previously handled by an infected person and then touching your hands to your eyes, nose or mouth. This is the main way that bacterial and viral infections such as salmonella, diarrheal disease, E. coli and even COVID-19 can be transmitted. But a lot of the times you can't control what you touch. But what you can look after is your hand hygiene, which can drastically reduce the risk of infection for yourself and everyone around you. This is why hand washing is now recognized as a top hygiene priority and is monitored as a part of the Sustainable Development Goal 6, Indicator 6.2. To demonstrate the importance of hand washing with the most dramatic example I could find, folks, let me introduce to you Ignaz Semelweis. Ignaz Semelweis was a 19th century doctor who's known as the pioneer of hand washing. Crazy thing to be known as the pioneer of, right? If he was alive today, he'd probably be amazed to find that billions were now hearing about his pleas amid a devastating pandemic. He observed in a ward that was staffed by physicians and medical students that up to 18% of new mothers were dying of a mysterious illness known as the childbed fever. By comparison, only 1 to 2% in the ward staffed by midwives were dying of this fever. He was very curious about this extreme discrepancy and started to dig in. He scrutinized everything from the climates to the crowd at each maternity clinic, trying to pinpoint the factors that led to a spike in one. The only obvious difference were the midwives. So he concluded that the autopsy physicians must be carrying around particles of decaying animal organic matter on their fingers. So he required anybody entering the room to wash their hands in the chlorinated lime bath, especially those who had just touched dead body. Within months, the result of this simple hygienic change were apparent and astounding. The maternal mortality rate dropped to 1 to 2%, matching that of the midwives' ward as shown in this graph. Now you might think to yourself, okay, I already know the importance of hand washing, but a lot of us don't know how to do it properly. P.S. It's like this, and moreover, we keep forgetting to do it. Before you start defending yourself, thinking that I always wash my hands, I'd like to talk about a very interesting study done by the Michigan State University back in 2013. As I mentioned before, the CDC says that you should wash your hands for at least 20 seconds, covering the back of your hands between your fingers and under your nails. The researchers had established that people generally tend to overstate the degree to which they wash their hands. The 3,550 subjects were divided into 3 categories. 1. People who did not wash their hands at all. 2. People who wet their hands but did not use soap. And 3. People who washed their hands with soap. In addition, the researchers timed how long each person spent scrubbing. The results of this study were, again, surprising. 67% of people washed their hands with soap, whereas 10% of people did not wash their hands at all. The remaining 23% wet their hands but did not use soap, which the researchers called attempted washing. Although the researchers generously counted the time spent scrubbing, washing and rinsing, only 5.3% people spent 20 seconds or longer washing their hands, thus fulfilling requirements of proper hand washing. The average time spent was 6 seconds. Think of it like this, only 5 in 100 people washed their hands properly. A lot of people missed in soaping their hands and satisfied themselves by only wetting their hands. Coronaviruses, like this year's version, which has left more than 43 million worldwide infected, are encased in lipid envelopes, basically a layer of fat. Soap can help break apart this fat and make the virus unable to infect you. The second thing which soap does is mechanical. It makes your skin slippery so that with enough rubbing we can pry germs off and rinse them away. Sounds pretty simple, but the vast majority of people don't get it right. These numbers were something which scared me a lot, especially during the pandemic. This made me decide to code and launch an iOS application, Handy Alert, which serves as an all-in-one hand wash guide. I kept in mind the right hand washing techniques as described by the WHO and sending people regular reminders to wash their hands in the form of notifications. Now, how many of you here go to school? Awesome. So most of you here probably have adequate hand wash facilities at school and never thought about that twice. Unfortunately, not everyone in the world has this privilege. Globally, 47% schools have no hand wash facilities at all. The largest burden of these reports come from sub-Saharan African and Asian regions, with a wide variance between countries. And over 272 million school days are missed each year because of poor or a lack of hygiene facilities. Moreover, COVID cases have surged in countries where schools have reopened. So, is there a correlation between schools and the spread of infection? A study done in California, Ohio, Tennessee, and Delaware show us that the use of an alcohol gel-based sanitizer in the classroom reduced absenteeism due to infection by up to 20% among 6,000 students at 16 elementary schools. Access to proper hand washing facilities, as well as the water needed for hand washing, and effective promotion that drives people to use them at critical times such as these varies widely across the world. This contributes to inequities in global health, nutrition, education, and economic outcomes. However, hand washing also has the potential to reduce inequities in global health, nutrition, and work. There's clear evidence that around the world, those in poorer households located in rural areas and with less education have lower access to functional hand washing stations as those in richer households, urban areas, and with higher education. In the Democratic Republic of Congo, for instance, financing the wash sector improved hand washing facilities by up to 81% in urban areas as compared to only 31% in rural areas. Moreover, researchers show that countries which have less than 5% wash facilities are highly concentrated in sub-Saharan African regions. Now, this information might be a lot to take in, and the inequalities, although very large, are being bridged by committed individuals and organizations all over the world. The UNICEF and WHO recently launched a joint initiative, Hand Hygiene for All, to support the most vulnerable communities with the means to protect their health and environment, bringing together international partners, national governments, public and private sectors to ensure that affordable products and services are available to all, especially to those in disadvantaged communities. Thank you everyone for listening.